Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in this today's very important video session, we are going to discuss a very important multiple choice questions and the concept behind the particular questions. So, the my point is very clear here to explain the very high yield content in a very easy manner and very understanding manner and in a way that where you people can remember that one and where you people can retain that one in your mind and where you people can able to remind that one in the exam and to give the best shot in the exam. So I will try my everything best here to revise all the golden points in this particular class, and I want your active participation in the comment box completely till the end of the class. Okay, so I'm requesting everybody of you to be actively participate in the watching the class, so it will goes in your mind. Okay, whatever the thing I'm explains. Okay, so don't hesitate to put the answer on the comment box, whether it may goes to right wrong or whether it may goes to right. So that is the reason, never ever hesitate to put the answer in the comment box. Whether if it's going wrong means what will happens, nothing will happen. You will learn better. Okay, and you will retain better and you will understand it better. Okay, your concept become better here. Okay, so that is the reason I will tell everybody of you, even you are watching the class after completing the live class, so don't stop to put comment box. Okay, so it is free, then no any money is required to put answer in the comment box. Okay, so completely be active in the comment box, keep on putting the uh, options and answers in the comment box, so it will help you to completely involve in the session. Okay, and it will not get bored to you, right? So a very good evening to everybody. Welcome you all once again to the master nursing classes. A very good evening to everybody. Good evening beta, very good evening, very good evening. Welcome you all once again to the master nursing classes, and a special request to everybody of you. So before entering to the class, so please do hit the like button and then enter into the live chat, so it will be very much helpful to me. Okay, so right, so fatapat do hit the like button who all are live to the session. A very good evening, right? And if anyone of you are watching the master nursing classes first time, so please do hit the subscribe button and it will help us to build our community, right? A very good evening beta, good evening, good evening. Yes, can we start the today's session? Is that sound and video is clear to everybody of you, right? Is that sound and video is clear? So please thumbs up in the comment box. Well done. So we will start the today's session with this powerful motivational line. So that is, success is not an accident beta. It comes out of a result of a hard work. It comes because of the consistent perseverance, learning, studying, sacrificing the things, and most important is the a thing which you have to love what you are doing. So that will gives you a success. Students, everybody of you know the exam is very near and every one of you are studying and definitely will get the good rank and you will get selected as a nursing officer. So after selecting, the golden memory of your journey is your preparation journey, and golden memory of your life is your struggling time. So that is the reason I keeps on telling you to you people, love the pain what you are getting as an aspirant, because it is it will add into your golden memory gallery. Okay, so that is the thing, whatever the thing you are doing, you have to love that one, so that will gives you a better future, right? So with this powerful motivational line, we will start the today's session. Okay, so the first question is here in front of you all. So it is very important question on the Leopold manner. First few questions, it will look same to everybody of you, but the answer of the every question is different and the questions are different here. Okay, so please do understand the concept what I'm explaining on the Leopold manner. Okay, focus completely on the explanation, and if you have any doubt, so please feel free to ask in the comment box. Okay, so because I'm here to clear your doubt and to improve your confidence, because it is the time to become a confident, not to become a confused person, right? So be confident and be bold to answer the questions. Okay, so here is the first question in front of you all. Do read the question carefully, completely till the end. Okay, read all the options, then put the correct answer in the comment box. Right, the question is very simple here. What is the primary objective of the first Leopold maneuver during abdominal palpation in the pregnancy? Beta, so very important golden points. Just before going to a question, I want to explain to everybody of you. So what is the Leopold maneuver? Leopold maneuver is the just a per abdominal examination what we are doing in a pregnant woman. Okay, so it is in the per abdominal examination what we are doing in a pregnant woman to assess fetal position and to assess fetal station and to assess fetal lie. Okay, and to assess the fetal presentation, totally to assess the fetus inside the uterus. We are doing the per abdominal examination. We call this one as the Leopold maneuver. Okay, so in the Leopold maneuver we have the type 1, type 2, type 3, type 4 Leopold maneuver. So every Leopold maneuver is very important and it is having its own clinical significance, and every Leopold maneuver will tell us about some very important situations of the fetus inside the uterus. So I want to explain what is the main objective of the each Leopold maneuver, because the main objective of the each Leopold maneuver will be directly asked in your exam, and there is highest chance of asking the image based question also from the Leopold maneuver. Okay, so before explaining the Leopold maneuver, I want to repeat some golden points on the Leopold maneuver. Just keep remember. Okay, so first point of the golden point about the Leopold maneuver is this is the per abdominal examination, and very important, what is the position you have to give during the Leopold maneuver? What is the position you have to give during the Leopold maneuver? So that is always remember a dorsal recumbent with knee flexed. Okay, with knee flexed. This is the position we have to maintain in the Leopold maneuver. This question may directly strike into our exam. Very important. And what is the like before taking a mother to do to perform the Leopold maneuver, what we have to educate the mother? So we have to educate the mother to empty the bladder. Okay, so very important. We have to educate the mother to empty the bladder before the examination. Very important point, right? So the next point, as a primary health care provider or the examiner to perform the Leopold maneuver, where we have to stand, whether we have to stand at the foot end, whether we have to stand the head end, or whether we have to stand the right side or the left side, where we have to stand. Yes, so as a primary health care provider or as a obstetrical examiner or as a gynecologist, if you want to perform the Leopold maneuver, you have to stand always right side of the mother. Okay, where you have to stand? So you have to stand always right side of mother. So very important point. Just try to keep in your mind these all the golden points, because these are the important for the exams. Okay, so the first point what we have discussed, so that is the position that we have to give is the dorsal recumbent with the knee flexed, and we have to educate the empty the bladder, and we have to stand always right side of the mother. Okay, so very important point we have to keep in your mind, right? So the next question of the discussion is here for you all. So the question is asked on the first Leopold maneuver. Okay, so the question is asked on the first Leopold maneuver during the upper abdominal examination. Okay, so are you able to see this particular image what I am showing here? So this is a Leopold maneuver number 1. So that is the first maneuver, and the Leopold maneuver number 2. So this one is the second maneuver, and the Leopold maneuver number 3. So that one is the third maneuver, and the Leopold maneuver number 4. So that is the fourth maneuver. Okay, so very importantly, what we are doing in the each maneuver, so that question will be struck in your exam, right? So first I will explain what we have to do in the first maneuver. Okay, so in the first maneuver, what we are doing, so that is, this is the uterus of the mother. Okay, this is the uterus of the mother, and where we are palpating this particular uterus of the mother. Okay, so that is I am palpating this particular portion of the uterus of the mother. So I call this one as in the fundal grip also. Why? Because I am palpating the fundus part of the uterus. Okay, so first maneuver we also call as in the fundal grip. Okay, what we call this one? We call this one also as in the fundal grip. Why? Because we are palpating the fundus part of the uterus, right? So I am palpating here, and now I am getting palpation of the this is the fetal head and this is the buttock of the fetus. Okay, so now I am able to palpate the buttock of the fetus here. Means in upper uterine segment buttock is there, means in the lower uterine segment head is present. So head is present in the lower uterine segment means the presentation is here as the cephalic presentation. So always and always first Leopold manner it will tells about the okay presentation of the fetus. Okay, it will tells about the how the fetus is presenting. Okay, so it will tells about the presentation of the fetus. So in the fundus buttock is palpated. In the fundus buttock palpated means yes, the presentation is the cephalic presentation. Correct? Why? Because in the fundus the buttock is there. It means in the lower uterine segment or in the pelvic inlet, so the head is there. So head is there down means there is the cephalic presentation. In the fundus, if you are getting the palpation of the head of the fetus, okay, in the fundus you are getting palpation of the head of fetus. Okay, so head of the fetus is in the fundus means the buttock is in the lower uterine segment. So buttock is in the lower uterine segment. What we call this one is in the, we call that one as in the breech presentation. We call this one as in the breech presentation. Okay, so very very important, just try to keep and remember. So the first fundal first grip or the first maneuver or the fundal grip, it will tell us about the presentation. So along with the presentation it will explain about the lie of the uterus. So how it will explain about the lie of the it will explain about the lie of the fetus. Okay, so very very important, second point of the discussion, it will explain about the lie of the uterus. Consider, so this is the uterus, right? Now the fetus is lying like this. Okay, it is in the transverse lie. So when I will do the fundal grip, okay, so how I will feel? So in the lie, if you want to know if the fundus is empty, if the fundus is empty means the fetus is in the transverse lie. The fetus is in the transverse lie. Okay, so if in the fundus you are able to see head, or if in the fundus you are able to see the buttock. Okay, so the fetus is in the longitudinal line. Okay, the fetus is in the longitudinal line. This particular concept I am explaining slowly, perfectly, because these findings you will get in the scenario based questions, and this one will help you to easily identify the scenario and give the best shot. So only you people are able to make these particular questions correct, because I am explaining according to the scenario what you people able to feel here. Okay, so remember, if you are able to palpate the fundus which is able to which is you are getting as a empty means the fetus in the transverse lie. Okay, so fundus is, if the fetus is lying like this, okay, so if the fetus is lying like this, so the fundus is obviously empty. Okay, if in case in the fundus you are getting the head, okay, means the fetus will be like this. Okay, so that will be a fetus is in the longitudinal line. Okay, very very important, keep in your mind. The first Leopold maneuver, it will explain about the presentation, and it will explain about the lie of the our particular fetus inside the uterus. Okay, so very very important point we have discussed here, right? So the next point of this discussion is, sorry, the first answer for this question is the, now please do mention your answer in the comment box. Yes, what is the primary objective of the first Leopold maneuver? It is to easily identify the part of the fetus which is in the fundus. Okay, so that is the primary object of the or first Leopold maneuver. In the fundus we are getting the empty means yes, the fetus is in the transverse line. In the fundus we are getting the head or buttock means the fetus is in the longitudinal line. In the fundus, we are getting the head means the buttock is down, the fetus is in the bridge presentation. In the fundus, we are getting the buttock means the head is down means the patient or the fetus is in the like cephalic presentation. So it will clearly explain about the lie and it will clearly explain about the presentation. Very, very important. Okay, so the primary objective is to identify which part of the fetus is lying in the uterine fundus. Based on that one, we will determine so the lie and presentation of the fetus. Hope it is clear to every one of you. Yes. So the next point of discussion is here. So that is the question number 2. I want everybody's active comment and the full participation in the comment box. Okay, so please do mention your answer about this particular question. Yes. Which Leopold maneuver involves palpating the side of the maternal abdomen to determine the location of the fetal bag? So in which Leopold maneuver we are palpating the side of the abdomen? Okay. So where we are palpating? We are palpating the side of the maternal abdomen to determine the location of the fetal bag. Yes, so that is the Leopold maneuver number 2. So that is the second Leopold maneuver. Yes, almost all of you have given the correct answer. So the correct answer is the second Leopold maneuver. Beta, look at this particular image number B. In this image number B, here the hand of the examiner is lying like this on the both side of the maternal abdomen. So that is the reason the examiner is palpating the side of the maternal abdomen. So the second maneuver, I will also call this one as in the lateral grip. I will also call this one as in the lateral grip. And look at this image. So here is the umbilicals of the woman or the umbilicus of the mother, and which is assessing both side of the umbilicus. So I will call this one as in the para-umbilical grip or the umbilical grip. Right? The second Leopold maneuver we also call it the lateral grip or the umbilical grip. Okay. So why we are doing this one? We are doing this particular second Leopold maneuver to determine the fetus position. Sir, how we have to determine the fetus position? Sir, in the first Leopold maneuver we have understood, sir, that is presentation of the fetus and lie of the fetus. In the second Leopold maneuver we will understand position of the fetus. Sir, how we are understanding the position of the fetus? Listen here and look at this particular explanation with image what I am explaining to you all. Okay, so this is the uterus of the mother. Okay, so here now the fetus is in this particular position. Okay, so fetus, consider this is the back of the fetus which is curved, and here is the head of the fetus. Okay, so very simple. Now this is the right side, this is the left side, everybody of you know. Okay, so here in the lateral fundal grip we are palpating the back at the left side, means the occiput is also left side. So we can say now that the fetal position, it may be a left occipito posterior, or it may be a left occipito transverse, or it may be a left occipito anterior. Okay, so if in case in the second Leopold maneuver we are getting the fetal back is this side, right? So it means the fetal back is right side, means the back portion of the head, that is the occiput, is also right side. So here the position, it may be a right occipito posterior, or the right occipito transverse, or the right occipito anterior. So among these three anyone is there, means this a lateral grip or the what we can say the umbilical grip or the second Leopold maneuver, it will explaining about fetal head is in which position. Okay, so mainly what is the main purpose is to determine fetal position. Okay, to determine fetal position. So that is the main purpose of the our second Leopold maneuver. Okay, so very, very important, keep in your mind, right? So the next question is this particular very, very important question, so that will be a very much helpful to every one of you. Okay, so yes, what is the main purpose of the third Leopold maneuver? So I want everybody's comment in the comment box So please do mention your comment, okay? So without hesitation, whether it may be a wrong or whether it may be a right. So please do mention your answer in the comment box, right? So what is the main purpose of the third Leopold maneuver? Option A is telling, so to identify the part of the fetus in the uterine fundus, beta. So this was the main purpose of the first Leopold maneuver, okay? This is the main purpose of the first Leopold maneuver, but in the question they have asked the third Leopold maneuver. Okay, so option B is telling to determine the location of the fetal bag. Better to determine the location of the fetal bag, we are doing the which grip? So that is the lateral grip or the second Leopold maneuver, or we can say the umbilical grip we are doing. Okay, so this is also not correct answer because in the question they have asked the third Leopold maneuver. Okay, so the next option is to option number C, to assess the part of the fetus above the pelvic inlet. Okay, so that is the presenting part, right? So this is goes to the correct answer. Okay, in the option C, that is the very important third Leopold maneuver. So this particular third Leopold maneuver. Okay, so understand this particular concept here. In the third Leopold maneuver, we also call this one as in the Pavlik maneuver. Okay, we also call this one as the Pavlik maneuver, or we also call this one as in the pelvic grip number 2. Okay, so this is the fourth one is the pelvic grip number 1, or we can call this one as in the deep pelvic grip, or we can call this one as in the fourth Leopold maneuver, right? So very importantly understand, our Leopold maneuver number 3rd is also called as the Pavlik grip or the Pavlik maneuver, and this is also called as the pelvic grip number 2. And the fourth Leopold maneuver we also call as the deep pelvic grip, or this is the fourth Leopold maneuver. Okay, so very important, or we also call this one as the pelvic grip number 1. Okay, so very important, understand. Okay, so here the question was asked related to the Pavlik grip. In the Pavlik grip, what happening? The hand of the uterus, so hand of the examiner is holding the fetal head by the near the pelvis of the mother. So that is the reason we call this one as the pelvic grip. Okay, or we call this one as the pelvic grip number 2nd because it is superficially holding the pelvis. But in the 4th, we are deeply holding the pelvis. That is what we call the deep pelvic grip or the pelvic grip number 1. Okay, so hope the concept is clear here. And in this particular third maneuver, what we are doing here is, we can say that is the Pavlik grip or the third Leopold maneuver. Okay, or we can say this one also as in the pelvic grip number 2. Okay, so in this particular situation, so what we are doing here, okay, so we are checking whether the fetal head is ballotable or not. Okay, ballotment is there or not. So what is the ballotment, or we can say fetal head is engaged or not. Okay, so we can say the fetal head is engaged or not. Sir, how we have to check, sir? So here we have to hold the fetal head like this, and we have to we have to shake the fetal head right left. If we are able to move the fetal head right left means we are able to move that one, means the head is still out of the pelvic inlet, so head is still not entered the pelvis, means the engagement is not happened. Okay, so if we are able to move the head right left means, so that is what we call as the ballotable. Okay, or the ballotment is present. Okay, so very important, ballotment is present means the engagement is not happened till yet. Okay, so what is the ballotment? Ballotment is the, yes, we are, if we are able to hold the head and if we are able to move the head right left, okay, so means the still the head is not entered into the uterine cavity, so that is the reason the head is, we are able to move. If the head is entered inside the uterine cavity, we are unable to hold the head and we are unable to move the head. Okay, so that is the non-ballotable, means the head is engaged here. Okay, so yes, in the third Leopold maneuver or in the Pavlik grip, what we are doing here, so we are checking the ballotment. Okay, so ballotment is present means head we are able to move right and left. Okay, So that is the, it means the engagement not happened. Okay. So ballotment is present means engagement or the fetal head still not entered the pelvic cavity. Okay, so engagement not happened. If the ballotment is absent, if the ballotment is absent, so that is the it explains that the fetal head is entered into the pelvic cavity. So fetal head is engaged. Fetal head is engaged here. Okay, so very important. This is what our pelvic grip or the pelvic grip number 2 or the third Leopold maneuver will explain about. Okay, so hope it is clear to every one of you, and the correct answer for this one, it will goes to the yes, it will assess the fetal uh, part of the fetus which is above the pelvic inlet. Okay, so that is the presenting part, so which is just above the pelvic inlet, we are able to move or not, so that it will helps to assess. Okay, so hope it is clear to everyone. Okay, so the next one is a very important question and very important concept to every one of you. Okay, as the same question have been repeated here. Okay, here is the next question, right? What is the main purpose of the fourth Leopold maneuver? What is the main purpose of the fourth Leopold maneuver? Right? So the next question is here in front of you all. So we have discussed the first, we have discussed the second, and we have discussed the third. So now I am discussing about the fourth Leopold maneuver. So that is the this particular image. Are you able to see the image number D here? Okay, so this is the first or the fourth Leopold maneuver. We also call this one is in the pelvic grip number 1. Okay, so this is the first one is the first Leopold maneuver, or we can say the fundal grip. Second one is the second Leopold maneuver, we call the lateral grip or the umbilical grip. And the third Leopold maneuver, we call this one as the pelvic maneuver or the pelvic grip or the pelvic grip number 2. Okay, so the fourth one, we are calling this one as the pelvic grip number 1 or the deep pelvic grip or the fourth Leopold maneuver. Okay, so very important. In all the Leopold maneuver, are you able to see here the head of the examiner? Okay, so this is the hand here, means the head of the examiner will be facing the feet of the mother. Okay, so sorry, head of the hand of the examiner here means, so hand like the face of the like examiner, it will be facing towards the face of the mother, right? So here also in the second one, here is the face of the mother, means the face of the examiner is always facing towards the face of the mother, right? In the third pelvic grip also, here this side the fetal examiner head is, means yes, here is the maternal head will be there. Again in the third Leopold maneuver is the head of the face of the examiner is facing towards the face of the mother, but here now the examiner hand will be like this, means in the downward direction. So now the face of the examiner is facing towards the feet of the mother. Okay, so in which Leopold maneuver the face of the examiner, it will faces towards the feet of the mother, means that is only one maneuver, the pelvic grip number 1 or the deep pelvic grip or the fourth Leopold maneuver, in the only in this particular maneuver. Okay, so where the examiner face will faces towards the feet of the mother. Okay, so very important, just try to keep in your mind, right? So in the all the Leopold maneuver means 1, 2, 3, the face of the examiner is facing towards the face of the mother, but in the Leopold maneuver number 4, the face of the examiner which is facing towards the feet of the mother. So this is the very important and basic concept, just you have to understand here. Okay, so now the question is like this. Okay, so what is the main purpose of the fourth Leopold maneuver? So is this option A, determine the fetus lie of the fetus? Yes, the lie of the fetus and the presentation of the fetus will be determined in the first Leopold maneuver. Okay, so then the option B, to locate the fetal back. The fetal back will be located in the second Leopold maneuver. Okay, so in the option C, to assess the degree of the engagement of the presenting part inside the pelvis. Yes, so very importantly. And option D, to identify the fetal part in the uterine fundus. So that is also will be done in the first Leopold maneuver. Okay, so the remaining option is only C, to assess the degree of the engagement and the presenting part into the pelvis of the mother. Okay, so remember what is happening in the fourth Leopold maneuver is, so it is very simple. These are the thigh of the mother. Okay, so these are the thigh of the mother, and here will be the abdomen will be there. Okay, so here will be the a big abdomen will be there. So the now examiner hand is here in the both lateral side of the sacroiliac ligament. Okay, so the examiner hand is this position. Okay, so in this position to palpate the maternal pelvis. Okay, so that is what we call the a deep pelvic grip, or we call this one as in the pelvic grip number 1. Okay, so or the fourth Leopold maneuver here. So what happening if the hand of the this particular examiner is converging like this, means the head is still not engaged inside the uterus. Okay, so these particular hands are coming like this together, means the head is still here only. Okay, so head is still not entered the pelvic cavity. Okay, so if the head is above the pelvic cavity, means the hand are comes together, so hand will converge. Okay, so if in case the head have been entered into the pelvic cavity and head is not available here, so the hands will diverge like this. Okay, so hands are diverging, means the fetal head is engaged. Okay, so again the fourth Leopold maneuver, it will be explain about the engagement. Okay, so very important. Okay, and it will helps to confirm a third Leopold maneuver. Okay, so it will helps to confirm the a third Leopold's maneuver. Very important, just try to keep in your mind, right? So this will be a fourth Leopold maneuver. Hope all the image also very much clear, and the golden point what I have explained on the image like Leopold maneuvers is very much clear. Okay, so now the very important question is in front of you all. So please do read the question carefully, completely, and try to give the best answer for this particular question, because it is important for every one of you, right? I'm waiting for your answer in the comment box. So please do completely involve and do response to the question. Yes, the question is very simple. Which of the following hormone is responsible for initiating the labor? Okay, so which of the following hormone is responsible for initiating the labor? Option A is the estrogen, option B is the progesterone, and option C is the CRS, that is the corticotropic releasing hormone, and option D is the oxytocin. So which hormone is responsible for initiating, means to beginning, okay, so to starting the labor? Okay, which hormone is responsible? So do mention your answer in the comment box. Okay, don't do any gadbad. Okay, understand the concept and give the best answer in the comment box, right? Yes, what is the hormone which is responsible for the initiating the labor? Yes, I'm waiting for your answer in the comment box. So do mention the answer in the comment box. Students, first understand this particular concept what I am explaining to you, so then you people can easily understand which hormone which is responsible for the initiating the labor process. Okay, so first thing, from the fetus inside the mother abdomen there will be a fetus. Okay, and fetus will be having the brain, and inside the brain there will be a hypothalamus will be there. Okay, so here the fetus hypothalamus, it will release the corticotropic releasing hormone. Okay, it will release the corticotropic releasing hormone. So this particular corticotropic releasing hormone, it will act on the fetal adrenaline gland. Okay, it will act on the fetal adrenaline gland, and from the fetal adrenaline gland, so there will be it will act on the fetal pituitary gland. It will act on the fetal pituitary gland, and from the fetal pituitary gland there will be release of the adrenocorticotropic releasing hormone. Okay, so there will be a release of the adrenocorticotropic releasing hormone. Okay, so or we can say the adrenocorticotropic hormone. Okay, so this adrenocorticotropic hormone, it will act on the fetal adrenaline gland. Okay, so from the fetal adrenaline gland there will be a hormone which will releases from the fetal adrenaline gland. So that hormone is the DHEA sulfate. Okay, so the hormone name is the DHEA sulfate. So this DHEA sulfate, will be used by the placenta and it will get converts into the estrogen. Okay, so this will be used by placenta and this DHEA sulfate will be converted into the estrogen. Okay, so if the estrogen is dominant, so that time it will increases the sensitivity of the oxytocin receptor. Okay, so it increases the oxytocin receptor sensitivity. If the oxytocin receptor sensitivity is increasing, means so that time the oxytocin it will act on the receptor actively and there will be a uterine contraction will happens. Okay, so this is how the labor process will begins. Okay, so the question was asked is, so which hormone which is responsible for initiating the labor process? Okay, so which hormone which is responsible for initiating the labor process? Yes, that is the, yes, which hormone? That one, the hormone which is responsible for initiating the labor process is the our CRH. Okay, so this is the answer goes to the very importantly keep in your mind. Okay, so answer for this particular question goes to the CRH. Okay, so not oxytocin, not progesterone, not estrogen. Okay, so the which hormone is responsible for initiating the labor? That is the CRH. If the question is asking like this, golden point revision, keep in your mind. Okay, so main important hormone, okay, main hormone for uterine contraction, that is the very importantly oxytocin is the main hormone responsible for the uterine contraction. Okay, so along with that a main estrogen or the abundant estrogen in the pregnancy. Okay, so most abundant estrogen in pregnancy, which estrogen is most abundant? Most abundant estrogen is, yes, which one? So that is the E2. That is the estradiol is the most abundant estrogen which is present in the pregnancy. Okay, so very important. Keep in your mind. Okay, so then comes to the most specific estrogen. Okay, most specific estrogen which is present in the pregnancy is the E3. Okay, so this is the pregnancy. Remember, in a case of the pregnancy, I am talking most abundant estrogen during the pregnancy is the E2 and most specific pregnancy estrogen during the pregnancy is the E3. That is the estrotrial. Okay, so these are the some very important golden points you have to remember here. Okay, so the next question is here. Yes, the already discussed question, which estrogen is most specific forms during the pregnancy. Okay, so which is the most specifically forms during the pregnancy, right? The most abundant one is, just we have discussed, that is the E2. That is the most abundant one is E2. That is the estradiol, right? So the most specific one is E3, or we can say the estradiol. Very important. Estradiol is the most specific estrogen during the pregnancy and the estradiol is the most abundant estrogen during the pregnancy. And where we will get the E1 or the estrone. Okay, so where we will get the estrone, beta, remember this estrone or E1 will be getting in the menopause. Okay, so which estrogen is abundantly present during the menopause? That's the estro1. Okay, so that's the, remember, ONE1 and come this like this here also ONE1. Okay, so ulta, remember in the estro1 we have the menopause. Okay, so menopause, in the menopause the most abundant estrogen is the estro1. In the pregnancy most abundant is the estradiol. Okay, so in the pregnancy most specific one is the, that is our estradiol. Okay, so this is the very important points just you have to keep in your mind. Okay, so estradiol is the E4 that is not having any important significance and it will not be asked in your exam. Okay, so very importantly try to keep in your mind whatever the concept I have explained here. Okay, so estro1 will be seen in the one in the menopause. Okay, and estradiol is the most abundant in pregnancy. Okay, and estradiol is the most specific in pregnancy. Okay, so very importantly, I hope all the golden points on the estrogen is revised here. Okay, so the next question is here. Yes, the question is very simple, very important. Remember this one. Yes, the question is very simple. Which of the following is primary function of the prostaglandin during the labor process? Okay, so which of the following is the primary function of the prostaglandin during the labor process? Option A, inhibit the uterine contraction. Beta, prostaglandin will increase the uterine contraction and it will not inhibit the uterine contraction. So I am eliminating the option A. Why? Because it is telling it will prostaglandin will inhibit the uterine contraction. No, prostaglandin will increases the uterine contraction. So I am eliminating the option A. Then comes to the option B. Promote the fetal lung maturation. But fetal lung maturation will be done by the surfactant fluid. Okay, surfactant fluid, right? So it is not will be done by the prostaglandin, right? So, but it is very much necessary for the various body functions like to keep the ductus arteriosus open and the other vessels to get open. So, but it is not a primary answer for us. Okay, so I am eliminating the option B also. Then comes to the option C. Yes, it will be responsible for the ripening of the cervix and stimulate the uterine contraction. Very important. The prostaglandins. Okay, so the prostaglandins we are having in the during the pregnancy is the prostaglandin E1 we have, the prostaglandin F2 alpha we have. Okay, so various prostaglandin we have, but in this one, which is responsible for the formation of the ripening of the cervix, that is the prostaglandin E2. Okay, so prostaglandin E2 is the very important and responsible prostaglandin which is responsible for the ripening of the cervix and uterine contraction. So that is the answer. Option C goes to the correct answer. Okay, so yes, prostaglandin which is responsible for the what all are the functions in the labor, means it will helpful for the ripening of the cervix and stimulate the uterine contraction. Okay, so option D, it maintains the progesterone level. No, the prostaglandin will not responsible for maintaining the progesterone level. Okay, so I am eliminating the option D also, right? So the correct answer for this goes to the option C. Okay, so here are the some golden points what we have to remember. Okay, here is the on the prostaglandin during the pregnancies. So that is the prostaglandin E1. Prostaglandin E1, that is the misoprostol. So this misoprostol we can use for the ripening of the cervix. So what is the ripening of the cervix? So just before the labor process will begins, that time the cervix become completely soft and increase the watery content in the cervix. Okay, so ripening of the cervix means completely soft and increased watery content in cervix. So that is what you call the ripening of the cervix. Okay, so that is what you call ripening of the cervix. In the ripening of the cervix, what happened here? Yes, there will be a softening and increased water content of the cervix, so which will be done by the prostaglandin E1, and the prostaglandin E2 is also very much important responsible. So if I want to give the one answer, so that is the cervical ripening will be done by the very important our prostaglandin E2, right? And prostaglandin E1, it is also having the ability to contract the uterus. So that is the reason this prostaglandin E1 also will be used in case of the postpartum hemorrhage postpartum hemorrhage control. Okay, where we will give the prostaglandin E1, that is the misoprostol. It will contract the uterus and it will reduce the bleeding. And we can use this misoprostol or the prostaglandin E1 as a medical abortion with the mifepristone. We will use this particular prostaglandin E1 also. Okay, but E2 is only is useful for the cervical ripening. Okay, so E1 is useful for the cervical ripening also and uterine contraction also, but dinoprostone, okay, so there is the prostaglandin E2, dinoprost 1 is responsible for the only one work, that is the cervical ripening. So uterine contraction will not happens by the dinoprostone, remember. So that is the reason we will not use this one to augment the labor or increase the speed of the labor. Okay, so that is a prostaglandin useful. E2 is the useless. Okay, so for the increasing the uterine contraction, it is not having any function. But it is having the main function to increase the watery content in the cervix and main content to make the cervix to get very soft. Okay, so that is the cervical ripening will be done by the prostaglandin E2. Very, very important. Keep in your mind, right? So then the prostaglandin F2 alpha, we call this one as the carboprost. Okay, so this is responsible for the postpartum hemorrhage treatment. Okay, so it is increases the uterine contraction. Okay, uterine contraction will be heavily increased by the carboprost, so that is the reason. So we can use this one in the PPH control. Okay, so very, very important. And in the second trimester, if you want to induce the like if you want to terminate the pregnancy by doing the abortion, means we can use the carboprost also here. Okay, so hope it is clear. Yes, the prostaglandin E2 is E1 is used both in the cervical ripening and in the cervical uterine contraction, means we can use the E1 in the induction of the labor also, and we are using this labor like even in the control of the PPH also, but E2 is only for the induction of the labor. Okay, so only for the cervical ripening, it is not having any role in the uterine contraction. Okay, so very important. Then comes to the prostaglandin F2 alpha. So mainly we are using this one to control the postpartum hemorrhage. Okay, so very, very important point on the prostaglandin. So there is highest chance of asking the question in your exam, so keep remember this one. Okay, because it is the very important chart for you all. Okay, so the next question is here. Yes, Fatafat, do read the question and give the best answer in the comment box. Yes. Which of the following is the common maternal symptom after the lightning occurs here? Yes, what is the correct answer? Which of the following is the common maternal symptom after the lightning occurs here? So what is the lightning, sir? Lightning means, understand beta, whenever the mother is in the late third trimester, so that time this particular height of the uterus will push the up mother diaphragm or the mother respiratory muscles up. Okay, so that time the mother will feel the shortness of the breath. Okay, so whenever the fetal head, it will goes down into the, okay, so whenever the fetal head, it will goes down into the maternal pelvis. Okay, so whenever the engagement will happens, so that time the height of the uterus will be decreased here. Okay, so that time what happens here, the height of the uterus will be decreased here, means the pressure from the diaphragm will be relieved here. Okay, so pressure from the diaphragm is released when the fetal head is engaged here. Okay, so fetal head is engaged means the pressure from the diaphragm is relieved. Okay, so now the mother will feel very light. Okay, so mother will feel a very light, or mother will feel very free, right? But the fetal head is engaged here, means the fetal is trying to come out. Okay, so that time the every family member should ready to welcome the baby. So that is what you call as the welcome sign. Okay, so that is what you call as the welcome sign. What happens in the welcome sign? So baby will be try to come out of the vagina and the mother will feel very relief. Okay, so that is what we call the lightening and the welcome sign. Very, very important point, just you have to keep in your mind, right? So increase the shortness of the breast, no better whenever the symptoms like lightning occurs, so that time the shortness of breath will decreases, it will not increases. So I am eliminating the option A. Okay, so then comes to the option B, it decreased urination. No, it is not responsible for the decreased urination. Okay, so then comes to the option C. So here relief of the upper abdominal pressure. Yes, the upper abdominal pressure is relieved and the diaphragm is free now, and the mother will feel she will not feel shortness of the breath, and she will feel very relaxed and she will feel a very light. Okay, so that is what we call the lightening sign. And when the lightening sign will happens, so when the fetal head is entered into the pelvic cavity, fetal head is entered into the pelvic cavity means, so that is the engaged fetal head. So engaged fetal head, you know, the engagement is the first stage of the labor. Okay, so now the labor process have been started, means the every family member is should and must get ready to welcome the baby. Okay, so that is what we call the welcome sign. So the correct answer for this particular question goes to the option C, goes to the correct answer. And I hope the thing is very much clear to every one of you. Okay, so here I am explaining all the pre-labor conditions, means before the onset of the labor process. So these are the very important points should happen. Okay, so first thing is the cervical ripening. Okay, so cervix become soft here, and the cervix become a very much watery in content, Okay, so this a soft and water in content cervix, so this is happening due to the prostaglandin E2, or it is happening due to the carboprosten. Okay, so which is useful for the cervical ripening. Remember the very important golden point. Okay, so the next a pre-labor thing which should happening here is the lightening. Lightening means I told, so this is the diaphragm of the mother. Okay, in the late third trimester it will be pushed off. Okay, so there may be a chance of the shortness of the breath will be there. Okay, so whenever there is in the fetal head which will enters into the maternal cavity, so that time the height of the uterus will decreases back to the normal. Okay, so the all the pressure will be relieved and the mother will feel very light, so that is what you call the lightning sign. And so here the lightning happen means the fetus head is entered into the pelvic cavity, so the fetal head is engaged. Okay, so fetal head is engaged means very importantly try to keep in your mind, fetal head is engaged here. So the fetal head is engaged means the baby is ready to come out. Okay, so the baby is ready to come out means the family should get ready to welcome the baby, so that is what you call as the welcome sign. Okay, so it is in the feeling of the relief by the mother. Okay, feeling of relief by mother after decreasing height of uterus due to fetal head engagement. Okay, so that is what you call as the lightning sign, or so the family should ready, so that is the welcome sign. Okay, so very important, this is a very important second pre-labor condition. Okay, so the labor should happen means yes, the cervix should be completely ripened, and the very important, the lightning should be happened here. Okay, so the next process, the next very important concept is the nestling. Okay, so what is the nestling? So nestling also a very important term here. Okay, so that is the yes 24 to 48 hours before the process of labor, mother will feel sudden burst of energy. Okay, so it is 24 to 48 hours before the process of the labor, so now the mother is feeling a sudden burst of the energy, we call that one as in the nestling. Okay, so the nestling should be happen before the like labor process begins. So this is also a pre-labor condition here. Okay, so very important. Along with this one, what happens here, the progesterone during the labor process will decreases, and the estrogen will increases during the labor process. Okay, so progesterone is there means it will be a smooth muscle relaxed and it will retain the water, but now the progesterone is decreasing means that there is no any smooth muscle relaxation and there is no any retention of the water, so there will be a weight loss will happens in the very important situation here in the pre-labor condition. Okay, so pre-labor condition, weight loss will happens, pre-labor condition, nestling will happens, there is a 24 to 48 hours before the process of the labor, the mother will feel the sudden burst of the energy, that is what we call the nestling. Okay, so the now a cervical ripening is happening due to the prostaglandin E2. Okay, that is the softening of the cervix and increasing the water content in the cervix, that is the cervical ripening. Okay, so the concept of the lightning also I have explained to every one of you. Okay, so these are the very important pre-labor situation. Okay, the pre-labor situation is very much clear means, so we can go for the process of the labor also here. Okay, so the next question is, which of the following is correctly describes the true uterine contraction? Okay, so pain during the labor. Okay, so here the question is asking characteristics of the uterine contraction. Okay, so characteristics of the uterine contraction, pain during the labor. Okay, so option A is telling yes, it is irregular, it is painless, and which will be relieved by the rest. Beta, so it is not irregular, it is regular, but it is the rhythmic means there will be a on. Okay, so there is uterine contraction, there is no uterine contraction, then again there will be a uterine contraction. Okay, so this is what you call as the rhythmic. right? So it is the regular and it is the rhythmic, but it is not irregular, it is not painless. It is regular, rhythmic, and painful. Okay, so these are the characteristics of the our normal uterine contraction. Okay, so that is the regular uterine contraction will be there, and uterine contraction increases the intensity and duration. Okay, and the cause, it will causes the cervix to get dilate also. Okay, so this is the a very important correct answer, right? So very importantly, remember the characteristics of the uterine contraction. Okay, so golden points revision. Golden points. Okay, so where, from where the uterine contraction is starts. Okay, so where the uterine contraction will begins, so it will begins from the carno of the uterus. Okay, where from here it is beginning, it is beginning from the carno of uterus. Okay, so this is the uterus, and this particular portion we call this one as in the carno of the uterus. Okay, so from here the uterus contraction will start to begin. Okay, so the how it will spread, it will spread downward direction. Okay, it will spread to the downward direction, means it will start from the carno of the uterus and it will come downward direction, and the speed is, speed of the uterine contraction is, that is the 2 centimeter per 1 second will be the speed of the uterine contraction will be there. Okay, so maximum contraction will happens in which part of the uterus? So maximum contraction will happens from the fundus of the uterus. Okay, so where we will get the maximum contraction? So maximum contraction we will get in the fundus of the uterus, right? So very important, and a characteristics of the uterine contraction is the must thing you have to understand here. Okay, so it will be a completely coordinated manner. Okay, so it is not an it is happening independently like this. Okay, it is not like this. Okay, so it is the completely in the coordinated manner. Okay, so it is coordinated means, so it is in the regular and it is the rhythmic, it is not continuous. Okay, it is the rhythmic. Continuous means uterine contraction started and contraction, so it is not like this. Okay, here is the contraction, relaxation, contraction, relaxation, so there it is the regular and it is the rhythmic, it is not continuous. Normally characteristics of the uterine contraction, it will not happens continuously. Okay, so the uterine contraction happens regularly and rhythmical. Okay, so contraction is there, relaxation is there, contraction is there, relaxation is there. Okay, so this is how the uterine contraction will happens. Okay, so that is what we call the regular and the rhythmic one. Okay, so next one, whenever the uterus will get contracts, so that time cervix will get dilate. Okay, so this cervical dilation, how we have to confirm? So we have to confirm this one by the per vaginal examination. Okay, so by the PV examination we have to confirm the cervical dilation. Okay, so the next one, whenever there is a uterine will get contracts, what happens? Yes, it will leads to the very important, so it will push the fetus to down. Okay, so downward pushing of fetus, so that is what you call is in the very importantly, yes, descent of the fetus. Okay, we call that one as in the fetus is getting descending down. Okay, so along with that there will be a polarity will be maintained. Okay, so there will be a polarity should and must maintained by the uterus. Okay, what is the polarity? Polarity is it is in the it is in the relationship between the upper uterine segment and the lower uterine segment, where the upper uterine segment is contracting very forcefully and the lower uterine segment is dilating. So this is what we call the polarity. Polarity is the coordination or the relationship or the mutual process or the mutual function between the upper uterine segment and the lower uterine segment. So that is what we call as the polarity. Okay, so in the upper uterine segment it will just contracts, but the lower uterine segment it will just dilate. Okay, so that is the reason we have to understand the polarity here. Okay, so hope it is clear to every one of you. Yes, so the next question is here in front of you, right? So what is the correct answer for this particular question? So please do read the question carefully, completely till the end, and try to give the best answer for this particular question here. Yes, What is the typical intrauterine pressure range during the second stage of the labor? So what is the correct answer? Yes. What is the typical intrauterine pressure range from the which happening during the second stage of the labor? Beta, if the examiner is asking the pressure which is in the first stage of the labor, okay, so that is the 40 to 50 mm of Hg, which will happen as the intrauterine pressure in the first stage of the labor. Okay, so in the second stage of the labor, okay, so the intrauterine pressure during the peak of the contraction is the 100 to 120 mm of Hg. Okay, so when the uterus is relaxed between the contraction, okay, uterus relaxed between the contraction, that time the intrauterine pressure will be only 8 to 10 mm of Hg. So we call this one as the basal tone of the uterus. Okay, so what we call this one is the basal tone of uterus. Yes, so 40 to 50 mm of Hg means that is in the intrauterine pressure in the first trimester, and in the second trimester 100 to 120 mm of Hg, that is the second trimester intrauterine pressure, and in the third trimester, so that is the uterus which will get relaxed between the contraction. So that time there is only 8 to 10 mm of Hg pressure will be there inside the uterus. So we call this one as the basal tone of the uterus. Okay, so very important concept I have explained to every one of you here. Okay, so try to understand the very important concept, and the very important table is here for every one of you. Okay, it is the very important table regarding the parameters of the uterine contraction. Sir, how to remember this one? So try to remember this one by the 3, 4, 5, 6, 7. Yes. So what is the meaning of this one, sir? Yes, there will be at least 3 to 4 contractions. Okay, it is not 3 to 5. It is the usually 3 to 4 is the standard one. Yes, the 5 is also normal one. Okay, it is not an abnormal one. Okay, so it will be a 3 to 4 contractions which will happen for the every 10 minutes. Okay, so that will be a normal frequency. Okay, so in every 10 minutes usually how many contractions should happen in the labor process? During the labor process, okay, so the 3 to 4 contractions every 10 minutes is the normal frequency of the uterine contraction. But if the contraction is happening more than 5 contractions per 10 minutes, okay, within 10 minutes there is more than 5 contractions have been happened, means, so that is what you call as in the tachysystole. Okay, so that is what you call as in the tachysystole. Okay, so there is one more important thing what you have to understand here is the, so that is the uterine hyperstimulation. What is the meaning of the uterine hyperstimulation? Beta, here the more than 5 contractions happening means this is what you call the uterine tachysystole. Okay, so in per 10 minutes more than 5 contractions is happening, we call this one as the uterine tachysystole, plus there will be a fetal distress. Okay, fetal distress plus the uterine tachysystole, we call this one as in the uterine hyperstimulation. Okay, so we call this one as in the uterine hyperstimulation, right? Sir, we understood that there will be a 3 to 4 contractions will be there for the very important for the 10 minutes. Okay, so this will be for the duration of the 45 seconds. So this will be for the duration of the 45 seconds. Okay, so the the duration of the each contraction will last for the per contraction should last for the duration of the 45 seconds. Okay, so intensity will be the 67 mm of Hg. Okay, so the pressure will be intensity will be the 67 mm of Hg, or we can say the in the range 65 to our 75 mm of Hg will be the intensity of the our particular each contraction. Okay, very important. The tachysystole of the uterine contraction is the more than 5 contraction per 10 minutes, and the intensity is the 65 to 75 mm of Hg, and the duration is the 45 seconds for each contraction, and the frequency is the 3 to 4 contractions per every 10 minutes is the normal frequency of the uterine parameter. Okay, so hope you every one of you have understood the a particular concept here. Okay, so now you will get the assignment question. Okay, so please everyone try to mention the assignment question answer in the comment box. Okay, the question number 1 is normal intrauterine pressure in second stage of labor. In second stage of labor is dash. Okay, so question number 2, normal basal tone of uterus in labor. So that is the a basal tone means it is in the intrauterine pressure during the relaxation of the uterus during the labor process. Okay, so what is the answer? Normal basal tone of the uterus in the labor. So how much is the pressure? So please do mention your answers in the comment box. Okay, so at the end of this particular video, hope everybody of you have enjoyed the particular session and the golden point what I am explained to you people. So till 3 to 4 classes will go on the OBG. After that we will finish the OBG and we will revise the golden point chanting on the pharmacology. Then after that we will revise the golden point chanting on the medical surgical nursing and the fundamental of the nursing golden point chanting I have already completed. Okay, so that one I am regularly posting a very important videos of the golden point chanting of the fundamental of nursing in the every days. Okay, in the YouTube channel and in the Telegram group daily I am posting and I am telling to you people to watch the video. Okay, so if any one of you are still not a part of our Telegram group and our what we can say YouTube like WhatsApp channel, so please you people can join to the channel and the Telegram group link I have given in the description box. And if any one of you are watching looking for the best test series for the our upcoming Norcet exam, so here we have the a very important and the best test series plan to every one of you. And the very important the offer is going on, the 50% discount is going on the Super 60 test series. If any one of you want to become purchase this one, you can purchase that one. Okay, it is very affordable price. If you see the price means you will get surprise. Okay, so the very less price we have kept, so you can, if you want to become a part of this one, you can join this one also. Okay, so here we are giving the daily live test from the 6 a.m. to the 11 p.m. and you will get the result at the 11:30 p.m. Okay, so 18 minutes 20 MCQs as per your exam section, the 5 section 100 MCQs which including the non-nursing portion and the nursing portion with complete rationale for each and every question. So for better practice and the better result, you can join the Super 60 test series today only. The app link I have given in the comment box and in the description box also. Okay, so thank you so much for watching the video till the end, and we will meet again in the tomorrow session. Okay, so we will finish this particular OBG. Okay, so in the next 3 to 4 session I will try to complete the entire OBG important points. Okay, so then after that we will discuss the pharmacology golden points of this special and very important drugs, and after that we will discuss the medical surgical nursing golden points. Okay, so thank you so much for watching the video, and if you are first time watching the master nursing classes, please do subscribe to the channel. Okay, and please don't forget to share the particular class to your WhatsApp status, so it will be helpful to build this particular your master channel. Okay, so if I am doing this much thing for you people, please means you can do the very simple thing for me, so you can share the class with your friends, with your college groups, and you can keep this particular video to your status. Okay, so that will be helpful for us. Okay, so thank you so much beta, thank you everyone. We will meet again in the tomorrow session. Tab tak ke liye bye, jai hind, jai bharat, take care.